You start the vestibular ocular exercises in the first week or the second week of recovery? I thought I saw one of your slides saying to start this after day 7. Someone wrote.
Yes. So day 0 to 7 from injury is what I call week 1. And after 7 to 14 is like week 2. So I recommend that people should start this on from the second week onwards. So like after the first 7 days. Because there is like a natural recovery portion within like the first like 3 to 5 days. Um and previously we did like try a study in which we actually tried to do a feasibility study in which we were like, okay, we'll start like prescribing these exercises from like the second day onwards, like like our aerobic exercise prescriptions. But a lot of these patients felt so symptomatic, like like we felt that we were just stressing the patients out unnecessarily. So that's why we're like, okay, let's maybe this is better to do from the second week onwards. Apart from the stuff that I have like presented on today, side by side, I also have a clinical decision rule called the risk of delayed recovery score. So the RDR score, I mean, I'm pretty sure some of you may have heard about the 5P rule uh, by Roger Zemek. Uh, I have my own diagnostic prediction rule. So the thing is, within the first 10 days of injury, you can, if you use that 6 point yes no answer thing, with almost an 85% diagnostic accuracy, you can predict that this patient will not recover at the 4 week time point. So for these people who score in like the high risk side of the RDR score, I actually tell my clinicians to, like just tell them from the second week, tell them to make their physical therapy appointment. And then by the 4th week, when they start physical therapy, they can just like walk into the appointment. So by using clinical decision rules, you can actually decrease. So, sorry, you can decrease, like unnecessarily expending healthcare resources, because if our physical therapist, if they make an appointment, for like a patient who ends up being a no-show, technically that appointment could have gone to someone else who would have actually gone for like physical therapy. So, like that's why I don't want everyone just like making appointments and then just waiting to see that, should I even go to my appointment or not? So that's one way of doing this. Uh, Maybe, sorry, I know that Lucas actually has a bunch to talk about this, so I will let Lucas mention this in his talk. So, if you are talking about the exact same concussive force, and like who is more likely to have a concussion, a 17-year-old versus a 22-year-old, there's so many other things that dictate, okay, who's more likely to have a concussion. Neck strength is one of them. But then there's also like lots of, like other risk factors that people don't really think about. So if you already have a migraine or migraine-like disorder, your brain is at risk for, well, symptomatic concussions with like lower like impulsive forces. I mean, so there are like lots of like those things. However, there's actually another way to actually look at this data. Which age group is more likely to have a concussion, period? So if you actually look in that group, the adolescent age group, so between the ages of 12 to 17, have the highest incidence of concussion, approximately 2%. But if you start going older or actually younger than 12 years old, the incidence of concussion starts going a lot lower, which is closer to like 0.5%. So why is this adolescent age group like so at risk? I mean, you have to like think about, like kids' behaviors and stuff like that. In my opinion, adolescents are still kids. Okay, but now they've gone through puberty, their bodies are getting stronger, they can start running a lot faster, they can start getting a lot more impulsive force, they can actually hit each other a lot harder. So there's so many reasons why, in my opinion, like teenagers are they're doing risky behaviors. And plus, during puberty, technically your brain is actually going through secondary like brain development. Like it's a thing that happens in everyone. So during this brain development period, maybe if you get like a concussion, that can like maybe like affect very proper brain development, which makes their concussions seem a lot worse. So remember I said that concussions in like adolescence, they take approximately 2 or 4 weeks to recover, but for collegiate kids, I mean they're back in like 7 to 10 days. So it's not who is more likely to have it. So if you're asking about who's more likely to have a concussion, definitely a 17-year-old because of this population statistics. But if you are talking about from the same impulsive force, then body demographics, resilience, there's so many more things to talk about. These are very, very good questions, and I thank whoever asked these. So for the first one, how do you deal with, like more power versus this? Okay. So target our heart rate aerobic exercise. This is only in the stage 1 to 2 of the 6-stage return to play protocol. This is before they start doing any strength resistant training or anything like that. So in these people, I would say if they're below the 80%, thing, please do aerobic exercise only. Okay, don't start doing like interval things. And like I said, you as a clinician need to know your patient and design an exercise program that your patient can follow. The recommendations that we give, like 3.2 to 3.6, I mean, these are just means of, like population averages. Everyone, and the thing is, only 66% of people are going to be within the mean of population averages, and 33% of them are not. So this is a clinical decision, and athletic trainers have the best clinical like skills to make this decision for their patients. Okay, so the second question, again, age appropriate heart rate is not applicable to all. 100% I agree with you. I know that I spoke about all of the heart rates and, oh, this is the prescriptions and stuff like that. However, our athletes are humans. No human actually knows exactly what their heart rate is or how to control their heart rate or keep them at a specific thing. They're going to start exercising and their bodies are going to tell themselves that, oh, this is the level of exercise or technically the level of exertion I should be doing. So the heart rates are very good for like an initial starting point, just to tell them what they're trying to do. But clinically or in real life, they're going to use their feeling while during these exercises. So it's very important to just explain and educate the athlete, like what is too much. Okay, don't go past this point. So if an athlete wants to do more exercise, we actually tell them to increase the duration of exercise. Don't increase the heart rate or that safe level. So instead of doing 20 minutes of aerobic exercise, maybe they can do 40 minutes. Or if an athlete like really, really wants to go back into sports, maybe they can do 2 20-minute intervals a day, as long as it's underneath their symptom threshold levels.